NCLEX note on metabolic disorder or endocrine system. Okay, let's start from DM. Diabetes mellitus is a chronic metabolic disorder characterized by high blood glucose levels due to either insulin deficiency or resistance to insulin. There are three types of DM: type 1, type 2, and gestational diabetes. In type 1 DM, there is autoimmune destruction of pancreatic beta cells and patient requires insulin therapy for survival. And type 1 DM occurs typically in childhood or adolescence and requires lifelong insulin therapy. Diabetic ketoacidosis is the potential acute complications to if it is not managed on time it can lead decay. And type 2 DM is chronic condition. There is insulin resistant and patient body cells don't respond properly to insulin. And this condition typically occurs due to lifestyle factors and genetic predisposition. Usually occurs in adults over 45 but increasing in children due to obesity. And if it is not managed on time, it can lead HHS, which is hypersmolar hyperglycemic state. For the NCLEX, main thing to remember is type 1 DM can lead DKA and type 2 DM can lead HHS. Okay, here we go for risk factors of DM. Genetic, age, autoimmune condition, viral infections are the risk factor of type 1 DM. Age, obesity, physical inactivity, family history, ethnicity, gestational diabetes is risk factor for type 2 DM. And obesity, age, family history are also the risk factor for gestational diabetes. Main thing to remember is the type 1 DM occurs among the young children, adolescents, and the type 2 DM occurs especially older age after 45. And signs and symptoms of diabetes are like classical symptoms of hyperglycemia, polydipsia, increased thirst, polyuria, frequent urination, polyphagia, increased hunger, fatigue, blurred vision, wounds that don't heal, frequent infections. And another thing to remember for NCLEX is hypoglycemia is the acute complications of DM. And in case of type 1 DM, diabetic ketoacidosis, and in case of type 2 DM, HHS. And the chronic complications are like retinopathy, neuropathy, nephropathy, and cardiovascular disease. And now here we go for treatment or medical management. For the management or prevention from this condition being severe, we need lifestyle modification, dietary changes, and regular exercise plus physical activity. In case of type 1 DM, insulin is needed for blood sugar control. In case of type 2, we can go for oral medication, or if it is not managed with oral medication, we go for insulin therapy. There are different types of insulin therapy like rapid acting insulin, short acting, intermediate, and long acting insulin. And here we go for nursing management. Regular blood glucose level monitoring is needed, and we need to check for HbA1c level, which provides long-term control of sugar. Ensure proper technique for insulin injection, rotate injection sites, and monitor for sign of hypoglycemia after insulin. Educate the patient regarding diet and exercise plus self-monitoring of sugar level. Managing hypoglycemia, recognize the sign and symptom of hypoglycemia like sweating, shakiness, confusion, dizziness. To prevent from further complications, daily food care, eye care, and kidney function test is needed. And managing acute complications like DKA and HSS, psychosocial support plus promoting complications like medication adherence and lifestyle changes. Let's go on another topic, DKA, the most important topic for NCLEX. It's a serious complication of DM, primarily type 1 DM. It occurs when the body produces high level of ketones due to severe insulin deficiency. In this case, the blood glucose reaches greater than 250 mg per dl, arterial pH less than 7.3, or acidosis, sodium bicarbonate less than 18, and presence of increased level of ketones in urine and blood. And the causes are like insulin deficiency, often due to missed insulin dosage, infection or illness, increased stress hormone during illness, stress or trauma. And must remember the sign and symptoms of DKA to guess the condition in case study type questions. In this case, there will be hyperglycemia, blood glucose level greater than 250 mg per dl, ketones in urine or blood, and fruity scented breaths, Kussmaul's respiration like deep rapid breathing as the body attempts to correct acidosis, dehydration, abdominal pain, nausea, vomiting, confusion, and altered mental status. in severe cases. And for the medical management of decay, fluid replacement is crucial in initial stage. Insulin therapy, IV regular insulin, monitor blood glucose level regularly to adjust the dose of insulin, electrolytes management, potassium and bicarbonate replacement, correct underlying causes of decay, monitoring and supportive care to the patient. And for the NCLEX, must know that initial management is fluid replacement. Okay, now here we go for HSS. Hyperglycemic hypersmolar syndrome is a serious complication of type 2 diabetes mellitus characterized by extreme high blood glucose level and severe dehydration without significant ketosis. It is often triggered by an illness or infection. And the causes are like patient with type 2 diabetes, mainly severe dehydration, infection or stress, some medications like corticosteroids, diuretics. And the signs and symptoms are like extreme hyperglycemia, blood glucose level greater than 600 mg per dl, severe dehydration, neurological changes, no significant ketosis and fruity breath. These are the symptoms which differentiate this condition from decay. Both of these, decay and HSS, are the most important topic for the NCLEX. Must know the signs and symptoms so that you can differentiate these both conditions in case study type questions. And here we go for the management of HSS. IV fluid replacement, normal saline to correct dehydration and restore blood volume. Switch to D5 when blood glucose starts to fall below 250 to 300 mg per dl. IV regular insulin to reduce blood glucose level slowly. Monitor blood glucose closely every hour initially. Electrolyte replacement, potassium and sodium chloride. Treat underlying causes of type 2 diabetes mellitus or other illness or infections. And the nursing managements are assess and monitor patient vital signs, monitor for sign of dehydration, altered mental status, blood glucose level checked frequently, and electrolytes level on blood, neurological status assessment, fluid replacement, IV fluids plus monitor urine output as well. Administer regular insulin to lower blood glucose gradually. Adjust insulin as needed to prevent rapid drops on sugar level. Electrolyte management, potassium replacement or other electrolyte correction. Treat underlying causes that might be infection, medication or other contributing factors. Educate the patient on proper diabetes management and hydration, especially during illness and infection.